Go ahead and get started. So welcome, good morning, good afternoon, everyone. My name is Jessica Palm. If I haven't had the chance to meet you, I'm our corporate manager of coaches here for Prime Healthcare, and we're excited to share with you the great case study we've done on St. Michael's Medical Center and the great work that they're doing there. And thank you to Dr. Sickles and Sarah for being with us today, and Amy, of course. And want to give a shout out to also to Grace Carstage, our corporate education director, because following this one, we're doing it on Teams for this webinar, but in the future, we'll be able to utilize Prime Academy, which we're super excited to be able to utilize for these educational programs. So welcome, some housekeeping items. Please try to stay muted throughout the webinar. Recording and presentation will be sent out afterwards, but please feel free to share this webinar or the recording presentation with your hospital leaders, and we will have a question and answer session at the end throughout the presentation. At any time, you are more than welcome to use that chat feature for any questions or comments. And we will go over that. I will host that later, and I'm turn it over to Amy Searls.
Yeah, welcome. So glad to have you join us today. Like Jeff said, in the room, we also have Millie and Holly, two of our corporate coaches. And I'm excited to introduce to you Dr. Sickles and Sarah Crespo. Sarah's our Regional Patient Experience Director for Region 2, and she has been just a joy to come on. But Dr. Sickles and Sarah together, what a dynamic duo. So I'm excited to talk to you today about some of the best practices, and they're going to share the things that they have, tapped into to help really drive their results. There's some similarities between what we've been doing, and you're going to see that these are, you all know, you can go to that next slide, Jeff. There's a lot of similarities to when you look at our high-performing organizations right now. And there are some things that are really drivers for those things. You all know that when we hit the pandemic, it was just hard. I'm preaching to the choir. The burnout, the fatigue, the census, the volume, the fear, all of that, the different waves, you've all had to deal with it. But there's some common themes that we're seeing in some of our high performers, and that's the reason we call them high performers, as evidenced by the HCAHPS improvements, the Google rating increase, people that are rounding on patients and staff, leaders, visibility, and then finally the coach tactics that are being rolled out and then ingrained into the culture. That's really, it can't be a one and done. What we say when we go out, and some of the programs that fail nationally are those programs that once a year do a big patient experience training and they think, okay, we trained our staff, now we're done, and so we're great. Well, that doesn't do it. It's this constant work that we have to do to help drive. And it's inspiration for our team, but it's also accountability. So I am going to talk to you about where the country has been. Those top couple slides or bars you're going to see, 75th percentile for PRC and the 50th percentile. All across the nation, Press Ganey has reported, NRC Picker has reported, PRC has reported that all across the nation over the last couple of years, there's been a decline in patient experience performance. And there are some folks that are doing the improvement. And, Dr. Sickles and Sarah are going to talk to you about some of the tactics that they've done. But what I want to tell you is nationally, you're seeing it all over. Initially, when the pandemic hit, there was a halo effect. Some hospitals, especially larger hospitals, academics that had that strong brand reputation, everybody took a bump. And we saw that even in Prime. A lot of our hospitals took a little bump for a couple months. But then you started to see it go down, and a lot had to do with visitor restrictions, right? Communication with families, wearing of masks and gowns, downing in and downing out, not having those real conversations, being able to sit at the bedside. And you can tell our patients, they were impacted by it. So really good to see that at St. Michael's, they did some extraordinary work to actually be kind of buck the norm in the country. So we're going to hear a lot about that.
And they saw actual continual improvement too in Q3 in 2021 and Q4, which is very impressive because nationally, everybody, we saw major impact in Q3 and Q4 last year.
Definitely. So Dr. Sickles, I'm going to hand it off to you to take it away and share some of your wins and how you did this.
Sure. So thanks, Amy. And thanks for inviting us to join today. So just a few words about St. Michael's. St. Michael's is an interesting place. We're really a safety net hospital in downtown Newark, New Jersey, very urban setting, just what you'd expect it to be, working within the Prime for-profit system. So you would think that one doesn't really go hand in hand with the other, but we found that that it does work, and we can continue to make that work. St. Michael's has a very long history. It's more than 150 years old. And actually, the original St. Michael's is just around the corner from where we sit today. It's a pretty incredible building. And St. Michael's has had good times and bad times, like every other hospital in the country. And at its height, it was probably the premier teaching institution in New Jersey. I know several hospitals claim to be the home of the first open heart surgery, but St. Michael's is one of those that claims it. And we've went through some really bad times. You know, when Prime purchased St. Michael's back in 2016, we were in bankruptcy. We were purchased out of bankruptcy, and I think it's a pretty typical story for Prime. I've only been here for about a year and a half. It's my first experience working in New Jersey and my first experience working with Prime. And really, St. Michael's is kind of on the cusp of a period of, I think, real growth. We've added a couple of really important programs in the last year. From a clinical perspective, we've added stroke, we've added neurosurgery, we've added a lot of structural heart to complement our existing cardiology programs. And we've expanded our academics significantly over the last year. So we now sponsor residencies in internal medicine and podiatry, and we have our own fellowships in cardiology, pulmonary critical care medicine, infectious diseases, hematology, oncology, and GI. So, you know, in the face of COVID and in the face of all of the other challenges, we are pushing very hard to grow and very hard to expand our footprint and stay firmly planted here in Newark. In any hospital, I think culture change is the most difficult thing you could ever attempt to do. And I arrived here kind of just after the very first wave of COVID. We have a staff that's been here for a really, really long time. We have people who I think were born here, who are working here now, close to retirement. And children of employees work here. It's a very family-oriented, and we have a relatively low turnover rate, at least pre-COVID, before everybody began quitting. And it was hard to think about changing that culture. So when you think about about the culture related to patient experience, it was pretty clear that we weren't going to make any progress until we were improving our standing and how patients felt about coming to work here. We really had, how staff felt about coming to work here. We really had to improve employee satisfaction in order to drive the scores. And I think that's what we've been really focused on more than anything, has been employee satisfaction. We've done very little direct work, you know, on the, like, teaching people how to increase the HCAHPS or coaching them to give better discharge instructions. Most of our effort has really been focused on, is the staff happy? Is the staff healthy? How do we keep them engaged? And I think that's how we've gotten our greatest success. Amy uses the expression all the time, helping people to find their why. You know, your why, your motivation, however you want to talk about it. Sometimes, you know, particularly after working someplace for a long time, in the face of the pandemic, it's really easy to forget why you chose this as a career and why you come to work every day. So I think by emphasizing that and by encouraging the staff to remember that we're here to give care to people, and they do a fantastic job. I mean, they're really great at it. You know, administratively, they give me plenty of heartache from time to time, but there's clinically, I can't say enough good things about our nurses and our ancillary departments. They really go above and beyond all the time, and we needed to recognize them and give them a chance to catch their breath. So I think that one of the things we talk about here at St. Michael's a lot is visibility. And I walk the halls, pretty regularly. Usually, I spend a lot of time outside of the C-suite. Once a week with Sarah, we make official staff rounds. We go to a different unit every week, and we talk to the staff. And it's really almost like a cultural kind of round. The conversations are very varied. It's the opportunity for the staff to bring up whatever they want to bring up. And it's really very, very transparent. And I never know what they're going to talk about. We always start the conversation in the same way. I always ask the staff, do you have everything you need to take care of our patients safely? Do you have what you need to do your job? And then honestly, it's off to the races. You don't know what you're going to encounter. This week, I learned that the batteries in our WOWs were holding a charge. And you know what? It sounds like a small thing, but it's not, because if something interferes with someone's ability to do the job they're here to do, they're unhappy. And if they're unhappy, it shows when they take care of our staff. So I think and one thing that we always do on staff rounds when Sarah and I are together is we talk a lot and we take notes. Sarah takes notes. And then I always make a point of getting back to the staff the same day if possible with a solution to the problem or an answer. And I think after a year and a half of me, they're used to it, and they understand that sometimes the answer is no, you can't have that, or that's impossible, because more often the answer is sure, we can fix that for you, and we do all the time. I think that when you think about leadership, and it's something I think about a lot, when you think about it, I think the most important thing when you're rounding on the staff or talking to patients or talking to the senior staff is authenticity. The problem that a lot of hospitals have, from my perspective, with patient experience programs is, you teach somebody some buzzwords, you teach them a couple of phrases, and it doesn't sink into the culture. It doesn't become part of who we are, because everyone handles it differently. And I think we have to just encourage people to be themselves, be authentic. They're here for a reason. They're here because they want to take care of patients. And if we encourage them to do that and support them in that process, we get really great results. So those of you who know me know I will talk for days on end if you let me. I promise that I'm going to stop here so I can let Sarah continue with the data.
Thank you, Dr. Sickles. Great job. And thank you, Amy and the team and everyone on the call for inviting us and having us here. Certainly piggybacking on what Dr. Sickles says, leadership visibility is really key to just getting out there, having our staff be comfortable with us. At first is the stairs, what did we do wrong? And then it's like, no, we're here for you. We're here to talk. So it's really a great opportunity to connect and just thank them. Just adding to a couple of our initiatives here, definitely is our patient rounds. And here at St. Michael's, every newly hired leader is going to receive training on Prime rounds. Every leader is expected to complete a minimum of 5 patients per week with their rounds. And on our month-to-month totals, we do review those with our CNO. We do an honorable mention for our rounders at our patient care council meeting. So, Nancy, our CNO, really makes it a point that, this is an expectation for all of us. I also use our morning huddle call to remind our leaders. So I have the Friday rounds. Dr. Sickles knows every Friday I remind everybody to get out there. And it's always with a message, really a message of human connection, right? Please check in on our patients. It's going to be the weekend, especially when you have visitor restrictions or limitations. It's really checking in on our patients, right? Rounding on our patients also gives us an opportunity to connect with them, We capture, we're also able to capture complaints locally in real time and really helps at the end to keep our grievances at a minimum. We can move to the next slide. So this is a great snapshot of our overall rating responses and how we are being scored on a scale from 0 to 10. You can really see a positive trend from Q4 of 2019 to Q4 of 2020. And we show about 80% of our patients are rating us with a 9 and 10. That's amazing. And just 4.5 rating us with a 6 and below. We are currently looking at taking a deeper dive into our 7s and 8s, and that's the yellows that you see on that chart. And we're working to identify those trends, work with our teams for any performance improvement, and eventually convert those 7s and 8s into 9s and 10s. So more to come on that. Next slide, please. So I'm a firm believer of constantly sharing data with leadership. Dr. Sickles and Nancy knows. However, I will say that the data I present can take on different forms. It doesn't always have to be the dashboard or the hospital rankings or the unit breakdowns. And what do I mean by that? Dr. Sickles and Nancy will receive their weekly scorecards electronically. Our entire leadership team will get a monthly email from me with all the reports and data detailed here on this slide, with HCAHPS, EDCAHPS, and prime rounds. I'll report out at at our leadership meeting, at least quarterly, a version of that data. And that's usually, after a discussion with Dr. Sickles and Nancy. What do we want to see? What do we need to share? Specifically is, what do I need them to know? Or do I need to prepare them for a site visit? So really, every meeting and every audience is a little different. So how and what we present can vary depending on that, but it's always, some version of some data somehow. It's important to keep your finger on that pulse. Slide. So here, our reputation management at St. Michael's probably looks very similar to you guys in your sites. We created our QR codes with a magnetic back that go on every patient whiteboard. We have our postcards that are distributed in all of our outpatient areas, clinics, and lobbies by appropriate staff members. I always tell them just not to have it, out on the desk. You want to have conversations. We want to encourage these reviews, right? And we have our thank you note cards for our inpatient areas, and these are hand-delivered by the nurse on the day of discharge, and we like that person-to-person contact as well. I do meet with the leaders regularly here and attend their department meetings where I'll discuss the importance of reputation management, how it benefits our hospital. I'll introduce and review the script as needed, and again, this is all for the purpose of engaging the staff. On our next slide, you can see here our current Google reputation at 3.7 stars. We are very proud of our rating. Just yesterday, I sent an email to our leadership with the Google rating of about 5 hospitals near St. Michael's, and we were by far the highest. So very proud of that. But, again, it's creating that awareness and making our team feel proud of where they work. Next to our Google review is a screenshot of an email I send out weekly, and it's our every Wednesday is Google Wednesdays, where I share 5-star reviews and comments received for the week prior with the entire leadership team to, again, promote awareness, engagement, enthusiasm. The team loves reading through the comments, especially when they receive an honorable mention. We usually have a nice chain of emails that follow where staff openly congratulate each other, and it just creates a really feel-good environment, which is needed now more than ever. And Dr. Sickles will usually come to my office right after the email and say, I'm running out of nice things to say. And we say, just repeat the thing. Just repeat it.
How many ways can you say awesome?
It's just great. Next slide, please. All right, so Bringing advanced stroke care to St. Michael's was one of Dr. Sickles' top priorities. So really, really thrilled when we performed our first successful mechanical thrombectomy here at St. Michael's a couple of months ago on a 90-year-old stroke patient. And thrombectomies can reverse brain damage in many stroke patients, so we are certainly all smiles that morning. And it was also great because Amy and the corporate team were here on site for their site visit, so they definitely shared in our joy. And, you know, we certainly took that opportunity to share this story on social media and celebrate our team members, and it was just, you know, a victory lap for us, definitely. And here, for any time we receive words of encouragement and gratitude, whether it's on cards, letters, through a phone call, it's, again, another great opportunity to share with the team. I often say, you know, it takes a village, so celebrating these wins and recognizing our team are really key to keep them engaged, appreciate their commitment, and let them know that they really matter. So shifting a little to our patients, we are sure to celebrate them as well, and we deliver a birthday card with a cupcake as appropriate. We carry 4 different variations according to restrictions and allergies. And patients really appreciate the gesture. They know that when they come to St. Michael's, they're not only going to get the great quality medical care, but we're delivering it with compassion. So that is our special touch. And our coach site visits are opportunities. That's how I set it up here. As soon as I get a date from our corporate team, I share it with the entire leadership team here. I send emails with attachments, with information. I discuss it in meetings. Again, just opportunities to review and hardwire any initiatives that we've been working on throughout the year, or any expectations at this point as well, to ensure that we're providing caring communication, customer service excellence through our initiatives like AIDED and First Impressions, and like Dr. Sickles mentioned, just always having them connect to purpose as a way to build resiliency in that connection. And I would say it's important for me to take aside some time to prepare my leadership team with everything they need to be compassionate, caring, St. Michael's team members, you know, really makes a difference. And it means a lot to us to make our site visits come alive with all the great work that's being done, not only from our team, but from our corporate patient experience team and all of our hospitals. And our next slide. Lastly, I'm going to leave you with some of our family pictures. We certainly have struggled through very difficult times, but, you know, we need to remind ourselves, and I often walk around telling the staff, these challenges do not define us. They make us stronger. So, you know, again, it's keeping that positivity going. You know, we're all on the same boat, but, you know, together we're going to get through this. And that's the message that I try to echo with everyone here. Dr. Sickles certainly knows. He does the same. Just, you know, keep engaging our staff, keep thanking them for showing up, keep thanking them for everything they do, because it is a very difficult time. And some of our key takeaways to success is definitely, you know, like I mentioned, continue sharing our message, continue expressing what that patient experience matters and it's important to us. Certainly something that, you know, when we do our new employee orientation, I let our employees know what the expectations are, what we stand for as a hospital, the initiatives that we have going with caring communication, leadership visibility, customer service excellence. It's all about creating those human connections, not only with our patients, but also our peers and other staff members. The importance of service recovery as well. You know, when you're coming in through that door in St. Michael's, you know, this is an expectation, that service recovery, that we're all responsible for service recovery. So it's not just one person doing it all. We have brought back our Patient and Family Advisory Council after a hiatus due to COVID. Our Employee Engagement Committee is up and running, and we're planning events on a monthly basis, even small events. It doesn't have to be elaborate. And, working closely with our nursing team to really set forth what patient experience is. Again, like Dr. Sickles mentioned, we haven't really been focused on too many clinical initiatives or bedside shift report, hourly rounding. Right now, it's really about the staff. It's really about just engaging them, making sure they're happy at work, and if they're not happy at work, how do we get them happy at work? So, I think it's that work that we're doing that's setting us up for some great work ahead of us when COVID is behind us. Oh, thank you.
So, Dr. Sickles and Sarah and Nancy, I want to thank you all so much because, when people ask me, and they do, they'll ask the coaches and they'll ask our team, Amy, just give us the secret sauce.
Yeah.
I wish it was that easy because this is difficult, but I love that you're focusing on your employees because that is really, and without happy employees, we can't have happy patients. So you guys are the models for doing that, and I'm so appreciative for all the great work you're doing. Dr. Sickles is a breast surgeon, and that first, and before he became a CEO, and he had natural empathy. And I think that helps an awful lot, too, is that leadership style that has that empathy, that empathetic leadership is so key right now. And bringing Sarah to the forefront to partner with Nancy and Dr. Sickles and driving this work is super important. Some of you may be saying to yourself, well, what do? I don't have a patient experience leader at my hospital. How do I do this? Because our hospital's so small, we don't have one. Partner with your coaches. We can help you get teams, patient experience councils up to date, or we can help you also get champions to help drive this work and partner with your coaches because this work can't be done alone, and it really takes a village to move it. So if you are at one of those small hospitals, don't be afraid to reach out. We're here to help you. So I'm going to turn it over to Jess now to do the Q&A because I'm sure many of you have some great questions.
As we're waiting for some questions to come in, I had some myself I wanted to ask about the Patient Care Council. What does that look like, and who's on that council?
I know Nancy's on the call, I believe. I'm not sure if she wants to take that one.
Let me make sure she's unmuted. She may, let's see. I'm not sure. Go ahead if you can answer that while I look for her.
Sure. So the Patient Care Council is made up of all of our CNOs.
Hi, I think I was on mute. Can everybody hear me?
No.
Yes.
Yes, we can hear you, Nancy. Hey, hello.
Thank you. Sorry about that. It's a meeting where all of my managers of all of the departments that I manage, there's around 30 people that we all get together every other week, and we talk about open communication. I keep them all informed of anything that's going on coming from the C-suite, and they also talk about any of the challenges or issues that they have. And what we do, we find out is that if there is something that's impacting another department, we resolve it right there. So there's give and take, there's open communication at all times. Sarah attends, she gives a presentation every time, encouraging all of the leaders to continue to do what they do so well and to work with their staff. We get reports from different departments. I invite other people from other departments that may not report to me when it's necessary. So it's just we have fun, we laugh a lot, which is great. I believe that humor is a great de-stressor. And we just have great times, and I find that it just encourages open communication again and working together, and it's a team effort. There is no silos in any of my areas. We all work together because the patient is always our focus, and they know what my philosophy is and my passion and love for what I do, and I'm very blessed that I have a great team, because I always believe I'm only as good as the people that I work with, and Sarah and Dr. Sickles are definitely high on my list.
Nancy, you're high on our list, believe me.
Charlotte, I see you have a question. Turn it over to you.
Thank you. I kind of got puzzled at first when Jessica said y'all had very little employee turnover, and during the COVID situation, especially being in New Jersey. So y'all don't you don't have a nursing turnover. You don't have travel nurses and agency.
No, we do. We have a lot of that. I was talking about in general pre-COVID, we had a very low employee turnover. With COVID and with the world as it is today, just like everybody else, it's a revolving door in some departments.
All right, so I that threw me at first. I was like, I want to know how you're keeping. I want to know how you're keeping these nurses stable, because we have such a high. I thought maybe you took all my nurses to be your travel nurses or something. So anyway,
No, we're all in the same boat.
Okay. So have you seen that? I'm assuming you have some agency and travel nurses there then. So how do you work with them to be as caring and compassionate? And I mean, we do the same thing, but they just don't seem to be committed when they come here. And how are you working that?
Before Nancy answers, because she's our nursing expert, obviously, I just want to say that, of course, it's very variable. It has to do with the personality of the travel nurse and all of that. But today, or yesterday, one of the travel nurses who's been here a while ended her contract and she joined our full-time staff. She was having such a great experience here that she chose to work here as a full-time employee. So I think that the whole concept of creating a welcoming environment, trying not to separate them from the rest of the staff, trying not to make too much of a distinction, because there's a lot of bad feelings in terms of money and responsibility, and I've been here forever and they came in yesterday. But we managed to make it work most of the time, and then I'll be quiet and let Nancy answer.
Everything that Dr. Sickles said is absolutely true. What we also do is the nurse manager is given the resume of a specific agency nurse, and the nurse manager interviews that person to get a feel for if they are going to fit into what our expectations are here. And I know we don't always have the luxury of being so choosy in these times, these unprecedented times, but we do vocalize what our expectations are very early with them, and we have canceled some because we didn't feel that it was a right fit. So, and in addition to them just feeling what you feel when you enter this facility, that the staff is all about the patient and working together, and we really have not had a problem. Just a few, but we've been very, very fortunate. But we are selective as well, as much as we can be.
Thank you for that, Nancy, and great question, Charlotte. That really hit home for us. It made us think about, I know we didn't really talk about during the presentation mental health and wellness resources, but Sarah, Dr. Sickles, Nancy, how have you been getting that out to the staff?
So we recently just got our posters up. We'll be placing those in all of our break rooms. Of course, the memos went out, 2 versions of it. We made sure that we got that out as well. And we've also started rounding with the going home checklist, which is really popular amongst the staff. And so we did put it up for a while also on our time clocks. So it's, again, keeping that message alive, and, every time that we have an opportunity, whether it's in a meeting or anything like that, to bring that up and to talk to our staff, to check in on them. It's also an opportunity, if I get any complaints or anything like that, to check in with that nurse as well to see, what's going on with her. and see how we can make ourselves available for our staff. You know, again, that leadership visibility with Dr. Sickles is key. Again, letting them know you're not alone. We're here for you. We care about you. So, you know, again, it's bringing that awareness and letting them know that there are resources for them.
And we're pretty aggressive about having some of those difficult conversations with staff, you know, sitting down with them, including physicians, you know, like something's changed. You're not the way you were 6 months ago. Is everything okay? You know, not prying necessarily, but offering the assistance if they need it. I think that, you know, that's an obligation of ours.
And the other thing that the administrative suite came up with, because we all focus on what the staff needs are for mental health and wellness and taking time off, but we sometimes feel that we forget about ourselves as the leaders that went through these unprecedented times. So I know Dr. Sickles and our director of HR came up with a wonderful thing that we're going to do next week. We're having a wonderful luncheon recognizing all of the leadership.
We tried to take everybody to Aruba, but they wouldn't let us. So we're settling for lunch.
So we have a wonderful menu planned, and just our way of saying thank you for all you've done and all you continue to do every single day.
I'm curious, what do you do to take care of you, though?
Yes.
I mean, this has to have been difficult for all three of you. What do you do?
Well, Nancy is very good about pulling me off the ledge when I'm opening the window and ready to jump. And I did the same for her. Sarah does check in with me all the time. You know, if she sees that if it's a bad day or a bad week or a bad month, Sarah does check in. She stops in all the time to make sure everything is okay. And our doors are always open. We're really very much involved with each other all day long, and that provides a lot of support.
Absolutely. And we use a lot of humor.
Yes.
I love it. Yeah, that's the perfect triad in my head. You guys are doing great work. Great work.
Yeah. Sarah, how about you? How do you take care of yourself?
Well, I absolutely lean on Dr. Sickles and Nancy anytime I need to as well. But Monday I did go to a concert, a Valentine's Day concert. Dr. Sickles said I looked tired on Tuesday, but I was okay. I was thinking.
I'll never say that again.
I love it.
But that said, you know, I did take a moment there and I thought, you know, how good it felt just to feel a little normal again. And you know, he certainly told me that the next morning. He said, yeah, it's just getting back to that normal stuff that we used to do, and just, you know, feeling that it felt so good was great. So, you know, it is important to take that time, but also lean on each other, you know, whenever we need that help or support, or, you know, something, you know, meeting didn't go so well, I check in with one or the other, we check in on ourselves, and just be there for each other.
Well, thank you. Great suggestions and ideas. And I see, oh, Nancy, yes. How do you take care of yourself?
I do use humor. I keep saying that. I always say to people, when I stop laughing, that's when you have to worry. But we are very supportive of one another. We're always checking on one another, checking on our families with each other. Just for an example, Sarah wasn't here very long, and she had an issue with her son that she couldn't get resolved, and she came to me and asked, and we made it happen in a few hours. And I spend a lot of time with my daughter and my grandsons and my brother, very family oriented. And I'm looking forward to the days that I can hug again, because I am a hugger. And hugs do help.
Oh, great. I'm glad you guys are spending time for yourselves, definitely, and your leadership. Ashley Swain, I see you have a question.
Hi, I just wanted to say that you all did a great job, Dr. Sickles, Sarah, and Nancy. And I just wanted to make a comment of when I first started, they were so kind enough to welcome me into their hospital, even though I am at St. Mary's, and they oriented me. And just the environment with being there, they were just so friendly, you know, no matter their titles, which sometimes, you know, as a team member, you can be a little intimidated. They were so human, and that made me feel so good with being there. So I just wanted to thank them for that and just give them their props for such a great presentation. So thank you.
Thanks,
Nice.
Ashley.
Thank you. Our pleasure.
Thanks. Well, that's a wonderful note to end on. Thank you to everyone across Prime. I hope you were able to take some nuggets from this. As Amy stated, we're here for you to help in every way. And let me say last word.
Yeah, and I just have one last question. I'm sorry to stop,
no,
but I was
go
thinking,
for it.
for all the leaders that are on this call right now, if there's one nugget you'd like to give them
Ooh,
to say,
good.
you know, this was the biggest win, or this is the one thing I encourage you to do, it would be fill in the blank. Dr. Sickles, why don't we start with you first?
So my fallback answer to that is always the same. It's we all went into this business for a reason. And if we can connect to that purpose, and if we can be true to ourselves and be authentic, I think we can carry the day.
Nice. Nancy, how about you? Love that, Dr. Sickles.
I echo that, and I think that everyone here knows that our doors are always open to them, and that we do genuinely care and we show it, and that goes a long, long way.
Thank you, I agree. Sarah, how about you?
Yeah, I would echo on both of them and just say, you know, it's all about the human experience. Doesn't matter if you're a patient or, you know, what role you have. It is about the human experience, and it is always about doing the right thing. So I tell everybody here, you know, I'm always going to have your back, but you better do the right thing, you know, because that's how
I love it, Sarah.
So I always err on that, you know, always bring your best to work. You know, you may not hit 100% all the time, but knowing that you tried your best, it should be enough. And then we should support the rest.
Well, you three are extraordinary leaders. We are so grateful for you and for spending this time with us today and helping everyone on this call learn a little bit about your journey and how we can be better. It impacts our patients and our team, and that's why we're here. So thank you very much from the bottom of my heart. Take care, everyone.
Thank you, everyone.
Bye.
Bye.